Well, let's look at the blood vessels of the body. Here's something that makes it a little easier to learn. Arteries and veins tend to travel together. In the systemic circulation, that's the circulation that is not involving the lungs, arteries will carry red blood away from the left heart. Veins will carry blue blood back towards the right heart, but they tend to course along together. They tend to have the same names. Let's look at some of these. The superior temporal artery and superior temporal vein. Facial artery, facial vein. Right here at the angle of your jaw, if you would just press there a little bit, you'll feel that there's a tiny pulse there. It's from that facial artery. You get a pulse when an artery goes over a bone. And right here, anterior to your ear, if you push just lightly, you can find a little pulse right there. Why not give that a try? Well, let's go down to where it all starts. It all starts at the heart. And for just a second here, I'll put the heart back in place so you can get your bearings. And then we're going to remove it again. I'm not interested right now in the pulmonary circulation, which is the pulmonary trunk, but I am interested in showing you the systemic arterial and systemic venous circulation. Coming out of the heart is the big ascending aorta, aortic arch, and then as I remove the heart, you can see the descending aorta. There are three big branches from the aorta. The first is unpaired. It's the brachiocephalic artery, and it divides to the subclavian artery and the common carotid artery. The subclavian artery supplies the right arm. The common carotid artery supplies the right head and neck. Next off the aortic arch, after the brachiocephalic artery, is the left common carotid artery, which is taking blood to the left head and neck. Then we have the left subclavian artery taking blood to the left arm. As we move on down, we can see that there are intercostal arteries supplying the thoracic wall, the chest wall. Let's look at the veins while we're at it here. They have the same name, and as I said, they tend to follow the arteries. Here we have the subclavian vein meeting with the external jugular vein and forming the right brachiocephalic vein. And here we have the superior vena cava. If I put the heart back in, you'll see that. On this side, where it's not dissected, we can see the external jugular vein. We can see the internal jugular vein. I call the internal jugular the brain drain vein because it drains the brain. This is the thoracic duct, which brings lymph back from the lower body and the left upper body, and we'll see that again. Subclavian vein, brachiocephalic vein, external jugular, internal jugular vein. There are more veins than arteries in the body, and this is an example. This is the cephalic vein. Now, cephalic means head. It's referring to the head of the humerus that is located here. But there will also be deep veins, as you see here. This is the brachial vein, and it becomes a more superficial basilic vein. When I remove the heart again, you can see an example of an extra vein. This is called the hemiazygous vein, and we can see the intercostal vein bringing blood back in the same location where the intercostal artery was taking it to and from the chest wall. What I want to do now is remove the liver and the stomach, transverse colon, the jejunum and ileum, the ascending and descending colon and pancreas, taking the kidney out, letting you look way back here. We call this the thoracic aorta. But as it moves down through the diaphragm, which it does, it's now renamed, as you would guess, the abdominal aorta. If you've heard of aneurysms where the abdomen, the abdominal aorta can swell and be weakened, this is where it happens. There's no muscle to push it back. But there are some important arteries coming off it, the abdominal aorta, and I would like to name those for you. The short little artery here with 3 branches is the celiac artery. Now you really can't see it because it's about maybe a centimeter or so long. This model makes it shorter, but imagine it as the stem of these 3 vessels. This is the gastric artery to the stomach, hepatic artery to the liver, and the splenic artery to spleen and pancreas, which are located in this vicinity. I can see the renal artery to this kidney and the suprarenal artery, which supplies the adrenal gland, and that's what you're seeing here on this side. There's the suprarenal. It's a little different in its location on left compared to right, but this is the adrenal gland. This is the adrenal gland. Here you have, again, the renal artery. Moving on down, there's a big superior mesenteric artery that supplies the small intestine and the first half of the colon. Then we have the 2 gonadal arteries. In the male, they're called the testicular arteries to each testicle. In the female, the ovarian arteries to each ovary. Here we have the inferior mesenteric artery that supplies the second half of the large intestine, from transverse colon, descending colon, and on down. Then we got a big fork in the road here. This is called the common iliac artery. Here we have the external iliacs, which change their name as they go through and supply the thigh. They also supply some of the muscles, the gluteal region. The internal iliac arteries will supply the various internal organs in this area, the bladder, in the female, the uterus. Now, as I go back up here, I don't seem to see as many veins in the inferior vena cava. I think I ought to see those. Well, where are they? The truth is that the digestive organs and the spleen have a special blood supply. Their venous blood is picked up and goes to the liver, because the liver is a biochemical factory that will pick up nutrients and will transform them, and then the liver's veins will empty into the superior vena cava and return that blood to the heart. So we don't see as many veins, not because they're not here, but because the venous blood from stomach, small intestine, large intestine, and spleen goes to the liver, and then once through the liver ends up right about here in the inferior vena cava. We do see the 2 renal veins, again following the renal arteries, and I can see the suprarenal vein bringing blood back from the adrenal gland on this side. I can see something asymmetrical, that is, the gonadal veins are asymmetrical. Here, the right gonadal, that is the right testicular vein or right ovarian vein, goes into the inferior vena cava. On this side, the left gonadal vein, that is the left testicular vein or the left ovarian vein, empties into the left renal vein. Down here, the pattern is very similar to the arteries. We see a common iliac vein, external iliac vein, and internal iliac vein. Let's go all the way down to the thighs and see what we can see. As the blood goes through the body wall, there's a name change from external iliac to femoral artery, and the veins have the same name. Again, there are more veins than arteries. This superficial vein here is called the great saphenous vein, and it can be used in cardiovascular bypass surgery. Let me go to the other thigh here, and I can see the femoral artery, femoral vein, and that's the femoral nerve. That's very typical. Arteries, veins, and nerves travel together.